This is Mr. T.
Hola, I'm Mr. T.
He's a 75-year-old Hispanic male who lives alone in a retirement community. His wife unexpectedly passed away 6 months ago. Mr. T's immediate family includes a daughter that lives in Texas and a son who lives in town but travels frequently for work. Mr. T identifies strongly with his Hispanic roots and attends church regularly.
Mr. T was of good health until 1 week ago, when he complained of increasing fatigue on a call to his daughter. He then started to feel nauseated. His neighbor came to check on him.
Hey, Mr. T. I came to check on you. How are you feeling?
Hola, Susan. Are you ready for La Navidad?
Christmas? Mr. T, it's summer. Do you know where you are?
Huh?
Mr. T's neighbor called the paramedics as he seemed confused to where he was. He was taken to the hospital in an ambulance and was admitted with complaints of fatigue, nausea, and slight confusion.
Mr. T's vitals are normal with a 2+ bruit from the left carotid. Neurologically, he is alert and oriented to person but not to place or time. Laboratory tests show a moderate amount of blood in his urine, abnormal white blood cell count. All other system findings were normal. Mr. T currently takes Lutensin for his hypertension and glucophage for diabetes and an aspirin daily.
Our nursing diagnosis for Mr. T is infection risk 4 related to unknown urinary tract bacteria as evidenced by patient fatigue, abnormal white blood cell count, and moderate blood in urine. Our short-term goal for Mr. T is patient will have decreased risk for infection as evidenced by decreased fatigue by end of shift.
The interventions for the short-term goal are 1. Encourage increased oral fluid intake. 2. Administer antibiotics as ordered. And 3. Encourage frequent and complete voiding of bladder every 2 to 3 hours.
Our long-term goal for Mr. T is patient will be infection-free as evidenced by patient report of no fatigue, absence of blood in urine, and normal white blood cell count by discharge.
The interventions for the long-term goal are 1. Encourage a diet that reduces acidic foods. 2. Encourage a diet that provides adequate protein. And 3. Promote rest and encourage relaxation techniques.
Mr. T, our goal for you is to decrease your fatigue by the end of the day and to get you infection-free by the time you go home.
How will you do that?
Today, my goal is for you to drink more water, completely empty your bladder every 2 to 3 hours, and start antibiotics that the doctor prescribed. During your stay here, we will start a diet that will help prevent bladder infection and help you rest and relax to heal before you go home.
Oh, gracias, muchacha.
A few days go by.
Good news, Mr. T, you are infection-free. You get to go home today.
Oh, gracias, muchacha.
The blood is now gone from Mr. T's urine and his white blood cell count has returned to normal, so Mr. T gets to go home. His nurse is now going to go over home instructions and teach him how to properly care for himself to help prevent recurrence of infection.
Okay, Mr. T, I would like to teach you how to better take care of yourself at home so you are at lower risk for infections in the future.
Oh, gracias, muchacha.
The nurse shows Mr. T the patient education brochure and discusses proper hygiene, hydration, diet, finishing his prescriptions, and what signs and symptoms to watch for in case his infection returns so he can return to the doctor.
Now let's evaluate Mr. T. Our short-term goal was met as evidenced by patient report of decreased fatigue.
Our long-term goal was met as evidenced by patient report of no fatigue, absence of blood in urine, and normal white blood cell count.
Now Mr. T is well and happy.
Oh, gracias, muchacha. I am so excited.